3 different lives. 3 different stories. But one single problem: high blood pressure. Meet Sarah, 35 years old. A teacher. She teaches not out of passion, but out of survival. Yet somehow, she's called a good teacher, because in her class of 60, only one student gets promoted. Legendary success rate, right? But lately, things have changed. Headaches, fatigue, her focus slipping. She finally visits her doctor. Blood pressure? 135. Diagnosis? Stage 1 hypertension. Now Chris, 32, married, works in an office where stress never ends. He's always under pressure. His boss demands more. Deadlines never stop. He works in the office all day for his boss, and continues the same job at home for his wife. The only difference? One gives him a salary, the other gives him orders. He smokes. He drinks. He sleeps late and wakes up tired. Headaches. Short temper. No rest. He checks his pressure, 145. Doctor says, "Chris, you're hypertensive." And then Mr. Shah, a truck driver by choice and by heart. He loves the road, the noise, the freedom. But cigarettes keep him company. And lately, so does alcohol. He's such a good driver. The traffic police follow him just to stay entertained. 60 challenge in 15 minutes. Even his license needed therapy. Last month, he lands in a hospital. Blood pressure? 155. Diagnosis? Hypertension. 3 people. Different worlds. Same fight. The doctor looks at them and says, "You all need change. Take medicine regularly. Lifestyle reset. Reduce salt intake. Keep salt under 4 grams per day. Less than 2 grams of sodium. Exercise regularly. Do 30 to 40 minutes of exercises. Maintain a healthy weight. Even small changes drop your BP numbers big time. Eat fruits like banana, tomato, apple rich in potassium keeps sodium low, plus whole grains, beans, and low-fat dairy. Monitor blood pressure. Keep track. Write it down. Take medicine as prescribed, as hypertension is a silent killer. Studies show that isometric exercises like planks, wall sits, and hand grip squeezes can lower blood pressure effectively. These exercises create static muscle tension, improving blood vessel flexibility and circulatory control. Just 4 to 5 minutes, 3 times a week can significantly improve systolic and diastolic pressure, reducing the risk of heart attack, stroke, and kidney damage. Avoid these traps because they can worsen your blood pressure. Avoid stress. Avoid smoking and alcohol, they push your BP higher than your stress levels. Avoid fried and junk foods, samosas, fries, burgers, pizzas, pickles. Avoid sedentary lifestyle. Get off that couch, your heart needs motion. Avoid ignoring doctor visits, follow-ups save lives. Important warning: if you experience dizziness, headache, blurred vision, chest pain, or shortness of breath, report to your doctor immediately. These could be signs of dangerously high blood pressure.
Doctor himself smokes, drinks, failed board exams twice, girlfriend dumped him, couldn't open a charity hospital, and now he's running a clinic telling us how to fix our blood pressure. He can't fix his own life, but he's here to fix our blood pressure and routine.
Three months later, Sarah returns, smiling, energetic, relaxed. She took her medicines regularly, exercised daily, and followed the DASH diet. Her blood pressure, 125, perfectly normal. Chris walks in next, BP 135. Not terrible, but his ankles are swollen. He relied only on medicine, skipped lifestyle changes. Now he's paying for it, mild drug-induced edema. And finally, Mr. Shah. He storms in with a pounding headache and blurry vision. Blood pressure? 185. Fundoscopy shows hypertensive retinopathy, because he neither took his medicine nor changed his habits. 3 months, 3 choices, 3 outcomes. What hypertension does to your body, the silent killer. First target, your heart. High blood pressure makes your heart pump like it's in a gym 24/7. Result? Left ventricular hypertrophy, heart failure, and if you keep ignoring it, congratulations, you might win a heart attack. Next stop, your brain. High blood pressure can burst small vessels, leading to stroke, bleeding, or memory problems. So if you forget your wife's birthday, it's either stress or hypertension. Then come your eyes. Hypertension damages the small blood vessels, causing blurred vision, retinopathy, and in severe cases, blindness. So yes, high blood pressure can literally make you blind to your mistakes and your ex's messages. Your poor kidneys filter your blood, but high blood pressure keeps hitting them like a pressure washer. Over time, chronic kidney disease, protein in urine, and eventually dialysis. You wanted a spa treatment, not a hospital bed. And don't forget your arteries. They get stiff, hard, and narrow. This leads to atherosclerosis, aortic aneurysm, and all those scary words you hear in exams. Basically, your arteries turn from flexible straws to old rusty pipes. So yes, hypertension doesn't scream. It whispers, slowly damaging your heart, brain, eyes, and kidneys until one day it says, game over. Control your blood pressure, take your medications, and eat less salt, not less happiness. Remember, I may have failed twice, but you don't have to fail your arteries. Stay calm, stay healthy, and check your blood pressure before it checks you. How to take blood pressure the right way. You'd be surprised how many people mess up something as simple as checking their BP. So here are 6 things you must do, and not do, while taking blood pressure. Rest before you test. Don't check right after arguing, exercising, or eating biryani. Sit quietly for 5 minutes, your BP machine doesn't like drama. Sit like a human, not a pretzel. Back straight, feet flat, and arm at heart level, not hanging like a wet towel. Silence, please. Don't talk, laugh, or check messages. Even gossip raises pressure. Use the right cuff. Too tight or too loose equals fake readings. Use a cuff that actually fits your arm, not your cousin's. Bare arm only. Roll up your sleeve. No jackets, no sweaters, no drama between cuff and skin. Take 2 to 3 readings. BP can fluctuate, so take 2 or 3 readings and use the average. Machines lie sometimes, humans too, but let's start with machines. I'm a doctor who smokes, drinks, failed my board exams twice. And yeah, even my girlfriend left. I wanted to open a charity hospital. But turns out you need money for that. So here I am, healing people on YouTube instead. Since I can't fix my own life, let's at least fix your blood pressure. Stay calm, stay hydrated, and don't forget to subscribe before your BP rises again.